Greetings, everyone. I'm happy to present some of the findings from our recent publication in eLife, which explores the effects of the COVID-19 pandemic on various aspects of cancer care. As we encountered the challenges of the COVID-19 pandemic, it ushered in a range of measures like lockdowns and distancing protocols, profoundly reshaping the healthcare landscape on several fronts. These included decreased medical procedures, redistribution of healthcare staff, increased reliance on technology for remote consultations, resulting in fewer face-to-face appointments, and limited access to healthcare facilities for patients. These adjustments had a profound impact on cancer patients, who often have complex and distinctive healthcare needs. To grasp the effects of the COVID-19 pandemic on cancer care, we conducted an umbrella review, a comprehensive analysis of systematic reviews. Our search spanned two databases, PubMed and the WHO COVID-19 database, seeking published systematic reviews with or without meta-analysis. These reviews had to have examined the impact of the pandemic on various aspects of cancer care, including treatment modifications, screening and diagnosis delays, psychological well-being, financial hardships, and the adoption of technology to enhance care. Out of the 1170 references we examined, 51 systematic reviews were deemed suitable for our analysis, including 14 that involved quantitative assessments. The majority of these reviews relied on observational data, primarily drawn from cross-sectional and retrospective studies. It's noteworthy that the bulk of these studies originated from high and middle-income nations and generally exhibited a low level of evidence. Out of the 51 reviews examined, 15 shed light on alterations in treatment approaches. Across these studies, there was a consistent observation of treatment adjustments, with certain reports indicating modifications in as many as 65% of treatment centers. These adaptations often entailed reducing the intensity of medical interventions or therapies. Furthermore, it's vital to highlight that existing guidelines were based on limited and low level of evidence and showed significant disparities concerning the roles and timing of surgery, especially in the context of early-stage tumors. This chart encapsulates key findings across four critical domains of cancer care. Firstly, treatment delays emerged as a common occurrence during the pandemic, with studies indicating up to a 20% increase in delays compared to pre-pandemic times. Additionally, there was a notable decrease in cancer screening across various types, including colorectal, cervical, and breast cancer, with estimates suggesting reductions of up to 50%. Furthermore, our analysis revealed that several facets of psychological well-being were adversely impacted during cancer care, with patients reporting heightened levels of depression and an increased likelihood of developing post-traumatic stress disorders. The prevalence of these psychological challenges among cancer patients saw an escalation of up to 20 to 30%. Notably, fears of cancer progression are in general prevalent among most cancer patients, but these fears surged by 70% during the pandemic. Furthermore, amid the pandemic, there was a notable increase in the utilization of telemedicine, primarily for facilitating virtual visits and consultations. While studies indicated that patients generally found telemedicine services beneficial, there were concerns raised that telemedicine should not entirely replace face-to-face appointments. In terms of financial distress and social isolation, limited research has been conducted. However, available studies generally reported financial distress, encompassing both direct and indirect cost burdens. Additionally, they underscored that cancer patients experienced social isolation, influenced by various factors such as fear of infection, adherence to social distancing measures, restrictions on visitors, and diminished social interaction during treatment. In summary, the COVID-19 pandemic has significantly affected various facets of cancer care. However, uncertainties persist due to the appraisal being predominantly reliant on limited and low-quality evidence. Moreover, the available data primarily originates from high-income countries, leaving a gap in our understanding of the impact of COVID-19 on cancer care in low and middle-income nations. Finally, I express my gratitude for your attention, and I invite you to explore our paper for additional details.